Hall Dairy on Thursday, the 11th of September 2025 at 4 p.m. So in attendance, we have an advance apology from Alderman McMorris. So Alderman Montgomery.
Here.
Alderman Wilkinson. Councillor Lillian Barr. Councillor Raymond Barr. Councillor Boggs. Councillor Clark. Councillor Deeney.
Should be online.
Coming online, Councillor Devine. Councillor Duffy. Councillor Hutton. Councillor McDaid.
Here.
Councillor O'Farrell. And Councillor Tierney.
Here.
Thank you, members.
So, members, we will read the broadcasting statement. I would like to remind everyone physically present at this meeting or in attendance remotely that this meeting will be broadcast live to the internet and will be capable of repeated viewing. The broadcast may be terminated or suspended in accordance with our protocol. Due to your attendance at this meeting, you are consenting to being filmed and to the use and storage of those images for broadcasting or training purposes and for the purpose of keeping historical records and making those records available to the public. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. A copy of the Council's privacy notice may be found on the Council's website. So, folks, declarations of members' interest, it can be done now or as we go along in the meeting, if anybody wants to declare anything at this stage. First of all, I would like to welcome everybody back from what I hope was a very nice, chilled and relaxed summer break. It's great to see everybody back, and we have a lot of good work to be doing now, so great to see everybody in the chamber today. So first of all, in our meeting, we have a deputation from Tommy Cannon from the Northland Centre. So Tommy, you're very, very welcome to the Health and Communities Committee meeting here today. And you will be presenting for 10 minutes and then we will open the floor then to questions or observations from the members. So Tommy, you are ready to go whenever you are.
Thank you very much. Thanks for having Northlands here. I'm delighted to hear that you all had a lovely summer break, whatever that is. I don't know what they are. But it kind of, so I suppose there's been a bit of a gap between the correspondence between ourselves and Northlands and me coming here, just through diaries and stuff like that. So yeah, it's good to be here, and I guess I've been invited here on the back of a funding issue that appeared for Northlands back at the beginning of this year, which we can talk a wee bit about. So, but first of all, if I kind of just talk a wee bit about the role of Northlands within the council area, but also throughout the north of Ireland, because we're very much a regional service. And whilst that, I'm even unsure if that's a formal declaration at the minute, by the very fact of the people that are coming to use our service from all areas and all trust areas, there's no doubt that we're a regional service. In terms of what Northlands offers, in the field of addiction, the services that are available to people in the centre, our non-residential treatment, which essentially is outpatient counselling, and at the minute we are seeing an incredible increase in the amount of people that are looking to access our service. We were talking about it more specifically last week within the centre. And it's easy to see that we have something in the region of a 300% increase over the last 12 to 18 months in terms of people that are contacting the centre looking for help, either for themselves or for family members. So the knock-on effect of that is that with the small workforce that we have, the waiting list at Northlands is growing for people that are coming for their first appointment. There was a time not that long ago where we started to get itchy feet if somebody had to wait more than 2 weeks for an assessment. As of today, anybody that phones Northlands is waiting up to 8 weeks to be offered an appointment, which, it upsets us, I think, because we're acutely aware that when someone decides or feels that they need help with their own suffering from addiction, or a family member's, to have to tell them on the phone then that it'll be up to 8 weeks before you see someone, is an indictment of the situation that we're in. So that's where we're at in terms of non-residential treatment at Northlands. In terms of residential treatment, we have 8 beds. We're commissioned service by the department to provide 8 beds. The greatest portion of those beds are taken up by people from the Western Trust and the Northern Trust, but we also have a substantial number of people coming from the other 3 trusts as well, which is important given that the funding that we receive really only comes through the Northern Trust and the Western Trust. Those beds today, so when I left the centre today, of those 8 beds, 7 are being filled. That will be 8 by Monday. 1 person will go out and 2 people will come in. Again, last year, in the calendar year of 2024, there were 67 people who availed of the 6-week residential programme in Northlands. That's the highest that it's been in maybe 2 decades in terms of the amount of people that are coming through. If we had more beds, we could have had more people in. There's no doubt about that. Family support is another element of what is on offer at Northlands. So essentially that means anybody that has a family member who's suffering from addiction or living with addiction can avail of support and counselling, regardless of whether the person themselves wants to come or feels ready to come for help. We have an education component built into non-residential work, which comprises of 4 information sessions for people to attend, sometimes as part of their non-residential work, sometimes as part of their preparation for treatment. In the last financial year, 24 to 25, there was 310 people availed of that service. And then obviously we have an aftercare program. The aftercare program is available to people that have been through the 6-week residential program. It's a 2-year aftercare program that sees people come back after they're discharged from their 6 weeks. They come back once a week for 4 weeks to see their counsellor individually, and then following that, if everything's okay, they're placed into an aftercare group, which there are 2 here in the city. There is 1 in Oma, there is 1 in Portadown, and there's 1 in Ballymena, which means that people don't have to travel any more than maybe 45 minutes to access aftercare. Again, in the last financial year, over 2,000 people have availed of those aftercare groups. Over 2,000 aftercare places were made available. So obviously it might be the same person coming week on week. So there's a lot of work that goes on. I guess what's interesting in that in terms of what we're talking about in terms of funding is that the only portion of that is funded through the Department of Health is the residential treatment. So the up to 700 people that we see non-residentially for assessments only. So that's not the counselling station, that runs in the thousands. But the 700 people that we offer an assessment to annually, very little of that is funded. So Northlands is meeting the cost of that themselves through the block funding or the commission funding that comes. The aftercare that I spoke about, those groups are facilitated by volunteers. And again, any cost to that in terms of hire or expenses is covered by Northlands. And the same for the information session. So when you listen to experts talking about the journey that people make through from addiction through to recovery, and the importance of education, the importance of residential treatment where required, the importance of preparation for residential treatment, the importance of aftercare, people will talk to us about how important they are, but they're not prepared to put the money in to support those services. Because to let somebody come in and have 6 weeks treatment and offer them nothing afterwards is of no help to anybody. So that's the services that that's on offer, and that's some of the issues that we're facing at the minute. In terms of the funding, so the main kind of block of funding, as I say, is coming through from the Department of Health, because so we're a commissioned service. We're commissioned to provide 8 beds, which we've been doing for 5 decades now, although the funding model through the department is not that old, but so we're funded there. The issue is not that funding remains in place. The issue for us was the core grant funding, which was used by Northlands to meet the salaries of the manager of the centre, the manager of the business services within the centre, the manager of the administration and information manager in the centre, and some of the housekeeping and cooking staff within the centre, as well as some heating and lighting. So that funding has been reported as being removed from Northlands. That's not entirely true. The application was made by Northlands after the department decided that it would cut that budget from 3 million to 1.5 million, but open it up at the same time to all sorts of different community organisations, which is fine. But you're in a situation then where Northlands' application wasn't successful, so you have a commissioned service by the department that is now not funded in terms of the management of that service, which for me just seems like a ludicrous situation. And we're not talking about a huge amount of money. So somewhere in the region of originally was 160,000. That was reduced to 125, to be reduced ongoing a number of years ago. The then Health Minister, Michelle O'Neill, stopped that cut, and that stayed in place until 2022, I think, when it was cut in half, and then it was opened up by the department. So the loss of that, it's not a huge amount of money in terms of the overall health budget, but again, it's an indicator to where addiction sits within the realms of the Department of Health. All our funding is around donations and fundraising, of which has increased just given the response to the cuts to Northlands within the city, which again is an indication of how important Northlands is to the people of the city in the northwest, which I guess is encouraging for us. In terms of then looking forward, so that's where we're at in terms of funding. In terms of looking forward, then some of the things that are important for us in the world of addiction and the future of addiction services is the plan, as it's called, the SPPG implementation plan, which talks about the direction of how services are going to be moulded over the coming years. And there's 2 reports that have been commissioned by the department and PHA. One is a Tier 4 review, which we have written our response to the department about. We weren't happy at all with that review for different reasons. And then there was a more localised Western Trust population-based needs assessment done as well. They've been done for quite a while. The Tier 4 review has been completed now about a year, and that will move to looking at a different commissioning model and procurement model for Tier 4 services, which Northlands is a Tier 4 service. So there's concerns from ourselves around what the future of Northlands looks like given that review and given the recommendations that come from it. I think that's me. It's a real kind of snapshot just in terms of where we're at and why I'm here. So I'm happy to take any thoughts or questions.
That's great. Tommy, thanks very much for that presentation. And I think, when you mentioned about the waiting lists, that's particularly where danger sort of happens when you're not capturing people at that right time. And I suppose, although some of the beds are funded through the Department of Health, it's important that you have the capacity to do that in order to give the proper service to those 8 people that come on over the doors. But I'll open it to the floor if anybody has any questions. Councillor Duffy.
Thank you, Chair, and thank you, Tommy, for coming in. And it has some time since we probably invited you in. I think it was back in April that we invited you in. I don't think anybody in this chamber, or indeed the council area, were no, just to rephrase that, I think everybody was shocked and surprised at the decision that was coming out of the Department for Health to remove the core funding or to not continue the core funding for the Northland Centre. The council area has always been really grateful and proud of the work that the Northland Centre does, particularly the dedication and care from the staff who work in there. And I mean, I think we were talking in our pre-meeting, I don't think that there's any families right across this council area who don't know somebody who has come through the Northland Centre and appreciate the work and the support that has gone into wider families, not just the person who is suffering from addiction, but the wider family network as well, in trying to deal with those issues and take them through that journey from addiction to recovery. And part of that is absolutely the aftercare that they get. The 6-week programme within the Northland Centre is absolutely vital. And as the chair has pointed out, sometimes if your waiting lists are going up 300%, if you're waiting extra time, if you're waiting 8 weeks rather than 2 weeks for even an assessment appointment, that the impact that that has on the person with the addiction is absolutely huge, because sometimes in that cycle of addiction, the exact point that you get the person in is vital to how successful that journey is going to be. So if they're at a point where they're ready and they have to wait a further 8 weeks, then that is going to set back that whole journey and maybe set it back further than it actually was at the time of referral. So that causes us absolutely great concerns. I think in terms of the work that you do, there is absolutely no doubt that the numbers there speak for themselves around the number of people that you have being referred, the number of people that you have coming through. I think that 2,000 aftercare places is absolutely huge across this council area, and we can only commend yourselves for the work that you do. I think that when I read the letter that came from the Department for Health in terms of the budgets that were available, I myself was shocked at how small that actual budget was, and then the actual amount of people who were applying for that small pot of funding. And that to me raises my own concerns around the priority around addiction and mental health services throughout the council area. And I think that the Department for Health needs to answer the questions around where their priorities lie, because we are a society that is coming out of a conflict. We are a society that has faced a lot of trauma, and there is a lot of trauma within families and within individuals, and that can at times transfer itself into addictions. So services like yourself are absolutely vitally important, and that is why we need the Department for Health to put priority onto these services. We need to be looking at that budget going forward to see what the Department for Health and what the Health Minister is actually going to do to prioritise them. I know that we're looking at the Tier 4 review and the Western Trustees assessment, and we know that there is absolutely need. We can see the numbers right across this council area. So I hope that we are going to see movement in terms of yourself, but that core funding, because whilst we can fund beds, and those are really important, those beds won't be run without a manager running the centre, without heat and light to keep the centre open, and without, if people are in a residential setting, they need to be fed. So all those things are vitally important to the running of a service, and we can't just rely on volunteers all the time. The voluntary and community sector can't be expected to always pick up the slack in these situations, and it is absolutely a health issue. It is a wider mental health issue as well, in terms of families and some of the trauma that they experience with the person who is going through the addiction. So all that support is really vitally important. Do you see, one of the questions that I probably have, you have said there that you have concerns around the move to a commissioning model. Can you maybe tease that out a bit around some of what your concerns might be for the Northland Centre around moving to a commissioning model? Because I would be very confident in the services that the Northland Centre provides and the work that it does and the reputation that it has. That's probably my only question at this time, but we will continue to work with the Northland Centre, work with yourself, Tommy. I know that you have met with Ciara a few times, and I've been over at the Northland Centre myself to see the work and the ambitions that you have for the future. So I would hope to see those come to fruition. So just around the commissioning model, the concerns that you have there, Tommy?
Yeah, sure. So I guess the idea around the future of commissioning for Tier 4B services in particular, which is Northlands, Carlisle House in Belfast, and Coonawarra in Newry, are the three providers of residential beds. The move within commissioning is around opening up that commissioning service to a more transparent or a more kind of open procurement process, which is fine. Northlands has always said we'll tender for it, no problem, because we believe that the work that we're delivering with the money that we have been given will be difficult for another organisation to deliver, given the fact that I've spoken to you about the amount of work that's been done that's not being paid for through that money. So I guess the map for that commissioning process will be heavily weighted on the Tier 4 review. And we have huge concerns around that review. We have huge concerns around, and not just ourselves. We've met with Carlisle House, we've met with Coonawarra. They also have concerns similar to ours and concerns of their own. So, for example, and this is where partly the review falls down for us, is that one of the recommendations is that all of the Tier 4B services should be regulated by RQIA. So Northlands and Carlisle House are currently regulated by RQIA. When we became regulated by RQIA, we lost our supporting people funding, because you can't be funded for care and funded for supporting people at the same time, is what we were told. So we lost that money at that time. Coonawarra are funded by supporting people to the amount of in and around £500,000 or £600,000 per year. They receive a small sum of money from the department. So a move towards having Coonawarra regulated by RQIA, which they currently aren't, would see them lose that supporting people fund, which would leave any kind of minister with a situation of having to close a facility like Coonawarra, which has about 90 beds, which is just a crazy situation. So that in itself, that recommendation in itself, aside from our own feelings around, let you talk about the reputation of Northlands, and I think that's been reinforced sometimes within Northlands. Somebody that works in it, you be somewhere aware of it, but you're getting on with your work, you're not acutely aware of it. Then when the funding issue appeared at the beginning of this year, and the response from people in the city reaffirms the reputation and the standing that Northlands holds within the city and the wider region, to read the review, particularly around the two authors' report on Northlands, was deeply saddening, if I'm being honest, to read what was written about Northlands, and the inaccuracies that are in that are there to be seen. Never mind what our feelings are around the direction of travel within the review. So if that's going to be a main part of the roadmap for future services, then you begin to see why we would be concerned and why we would be worried.
Thank you, Councillor Ruffy. Thanks, Tommy, for your response. And next, I have Councillor O'Farrell. Anton.
Thanks very much, Chair, for letting me in. Tommy, I just want to praise your work to high heaven. I can say this, as a family, we're indebted to the work of Northlands, Coonawarra and AA and people like yourself. And I just hope that your work long continues. Society as a whole is indebted to you and people like you, because alcohol used to be the main addiction. Nowadays we have God knows how many. It's not just alcohol anymore, it's drug addiction as well, and it's on the rise. So it's essential that we keep places like yourselves and Coonawarra open. So Goneri Gogalat and Mackenshaw, the best of luck in the future, Tommy, and Gurmila Magaras Hack. Thanks very much for coming in.
Thank you, Councillor O'Farrell. Next, Councillor Barr.
Thank you, Chair, and thank you, Tabby, for coming here today. I don't think there's anyone in this committee or indeed this council that doesn't recognise the immense contribution the North Ends makes to the community in the North West, or indeed, as Tommy's just alluded to, the region. But in relation to the loss of funding, Tommy, can I ask, has there been any direct contact between North Ends and the Department of Health, or indeed the Health Minister? What sort of relationship exists between yourselves and those bodies?
Yeah, historically, I would say that our relationship with the Department of Health has been strong, and that would have always have been kind of reflected in the regular contact that we would have had, particularly in Health Minister's visiting the centre and taking an interest in the work that we do. We've experienced real difficulties in engaging the Department of Health over the last 12 to 18 months, particularly around this issue of the loss of the core grant funding. We have written to the department and to the Minister directly on a number of occasions, asking for a meeting, inviting them to the centre, whether that be and we weren't that kind of troubled, whether that would be in a formal way or in a very kind of informal, private way. Had the Minister been in the city, we were happy for him to call and have a informal conversation with us. And part of that conversation that we want to have, I guess, is around three things. One is it's around the core grant funding issue, and then the response to council. You'll see that the Minister talked about it wouldn't be appropriate for that money to be reinstated, because the decision's been made through a process, which is fine. We're not looking for that decision to be reversed. What we're asking from the Minister is that that money is included as part of the overall funding that we get, because I don't believe, not Northlands, but I don't believe addiction services at the level of residential treatment should be scrambling about for pieces of funding where other community and voluntary organisations may benefit more from it. That money should be part of the main body of funding. So it's not about reversing the decision, it's about making the decision to add that 160,000 onto the whatever it is, 600,000 that's already there. That would be a better decision. So there's that. There's also the issue of the £1 million that was discussed and indicated in the New Decade New Approach for an addiction centre in Derry. As far as I'm aware, there's only one addiction centre in Derry, London Derry, so it would be obvious that was Northlands. That was negotiated by Northlands. That seems to have since been subsumed into the Department of Health's planning for the provision of addiction services throughout the council area. And yet there's no real indication as to where that money would go. And then the third thing, as I talked about, is the future of addiction services and our concerns for that. So we have asked the Minister for a number of meetings. They have been pushed back for well, I think for different reasons, but somewhere along the same reason, in that it wouldn't be appropriate given that there was a report being done. Then it wouldn't be appropriate given that the consultation on the report was to be done, and then it wouldn't be appropriate given that the report has been completed and there will be a commissioning process to happen. So I think the last time we had anybody from the Department of Health meet us was Robin Swan and around COVID, which is long enough ago. So yeah, we are very, very keen, and I think as a united front between the three Tier 4B services, we will request again a meeting with the Department of Health and a meeting with Mike Nesbitt.
Just on that, maybe that's something that this committee or council could reinforce, that request that the Minister does meet with North End Centre. You know, if it takes a proposal, I'd propose that, or maybe it could just be in the form of a letter. Thank you, Tommy.
That's fine, Karen. There can be a letter sent on the back of the letter that we've received just to say that the deputation has taken place and that is a concern by the Northlands, and see where that takes us.
Yeah, just a point of information. We did write to the Health Minister back in April and ask that the Health Minister meet with Northlands. So we had hoped that that would have happened.
Well, we can just refer to that request and say that there's been no response since the last letter. Thank you, Councillor Duffy. Councillor Harkin, you're next on the list to speak.
Thank you, Chair, for letting me in, and thank you to Tommy today for coming in and giving us an overview of what you do. And I want to thank yourself and the staff for the work that you do. And I think you're right that the outpouring of concern across the city and the district and the Northwest really, I think, shows the importance that a lot of people hold the Northlands in because of the work that it does, because you do save lives, you do save families, and you do help communities to stay resilient. And you know, a lot of what you said today has left me more concerned, to be quite honest, about the future of Northlands. And I think that obviously the funding cut, even if it was small, was very disappointing. But I think that the response to it in terms of people's anger and concern, I think demonstrated that a lot of people can see the fragility and the vulnerability of a lot of key services that people depend on here. So you think about, you know, it wasn't that long ago we had a massive campaign to save Foylehaven. We lost recently, or it closed down through lack of funding again, the Crisis Intervention Service. And I think people understand that there is a massive addiction crisis, a massive health crisis, and that if things keep going the way they're going, you know, with health inequalities, deprivation, these are likely to worsen. And then the services that we need to actually help address it are fragile. And that's what you're telling us today. The future of Northlands isn't secured. It's actually quite fragile. So we did back in April agree that we would write to the Minister because that was one of the things that you were hoping would happen, that there could be a meeting, not even a meeting like this, where we would grill the Minister about the funding cuts in the future of Northlands. So it's very disappointing that he has made excuses for not doing that, because he could have easily have found an hour, I'm sure, to go and visit you and have a conversation where you could raise your concerns directly. And it wouldn't even have necessarily been in the public eye. So that's why it's frustrating and disappointing. In terms of the fundraisers, I do think, I mean, you know, I think the staff and yourself should take a lot of confidence from that, because, I mean, you know, you said that some of the lost money has been made up by those fundraisers, and I see football teams, bowling clubs, trade unions are donating. I mean, all sorts of things where people are basically trying to do whatever they can in the absence of, like, or the failure of government to properly fund. But that's not sustainable, I don't think, into the future. So I suppose in terms of the questions I would have for you is, one, like, is this council doing enough to support addiction services in our council area? And what more can we do? Because I think that's what we need to hear. Obviously, for the Northlands and for addiction services more generally, what else can we do? When you said that it used to be a 2-week wait and now it's an 8-week wait, I mean, I'm assuming that's just because there's so many more people now that need access to the service. What does that mean in terms of the people who don't get immediate access or have to wait that long? How is that compounding the crisis that we're facing, and what do we actually need to address that? Because that just seems, because it, you know, if it's 8 weeks now, when is it going to be 12 weeks? And that, what does that mean for your ability to actually, you know, properly address the scale of the crisis? And then just, yeah, look, what you're saying about there was a plan that you helped to create and design about a future, an upscaled addiction service centre. And it sounds like from what you're saying today that that is not by no means guaranteed, and we can't depend on that. And I'm assuming that was part of your plan to address the scale of the crisis. And now it looks like that there's no guarantee of that funding, there's no guarantee of that plan ever coming to fruition. And I know you and others spent, a decade working on it. So that's got to be very, very frustrating.
Yeah, so I'll try to work through all that stuff, Sean. Yeah, look, when you listen to because it's not just about Northlands, you talk about the Haven and crisis intervention services and the loss of those. What's interesting in that is that that's more addiction services gone, and in the years that I've been working in addiction and working with Northlands, it's evident to me that addiction services are the Cinderella of the health service. Of that, I'm convinced. And no doubt the government will point to commitments here and commitments there, but it's nowhere near touching the sides of what's going on. The reality, if you want to read through some of the NISRA stuff, or you want to read through some of the statistics, is that the problem is getting worse. And that's evident in the year-on-year increase within Northern Ireland of people dying from drug-related deaths and people dying from alcohol-related deaths. That has increased year-on-year over the last decade and shows no sign of reducing. So you have that trend on the one hand, and then on the other hand you have acute services like residential treatment services losing funding. And that, in my head, makes zero sense whatsoever. So that needs to be said. Yeah, what does the waiting list mean for people? Look, it's really obvious to me as someone that has availed of the services at Northlands that when you decide, as someone living with addiction, when you decide that you need help or you want help, that window only remains open for a short period. And it disappears again and reopens, hopefully, somewhere down the line. In some occasions, it doesn't reopen and people are lost forever. So to be able to respond to addiction in a timely manner is crucial. When our waiting list, and what I'm talking about, talking about when somebody picks up the phone and says, I need some help, when we were able to say, look, we'll see you in 10 days, even at that point, we felt that was too long. But you could manage that. When you're now saying to somebody, yeah, surely we'll see you in 7 weeks or 8 weeks, but we've got a cancellation list if you come on it. You know what I mean? Like, you hear that from the dentist and you think, all right, I'm going to have to wait, whatever. But when you're talking about addiction, that is just too long a wait. And people that are phoning us from outside of the council area, for example, from Belfast or Bangor or as far out as Newry, and you're saying to them it's going to be 6 or 7 or 8 weeks, that to them is actually good news, because some of the other statutory services that they're phoning are not able to even meet them at that point. So people, and that's why I think a lot of people are phoning Northlands as well. But that is we don't have to look too far in terms of waiting lists to know that is that has a domino effect. Waiting lists create waiting lists create waiting lists. So unless you find yourself in a situation where you're able to employ more people to deliver the work, then that waiting list is going to remain, if not increase. So that is an ongoing concern and an ongoing worry for us at the centre. And they're difficult phone calls. Like, when I talk about, I suppose it's important to make it clear, like, when I talk about the funding that has been lost in Northlands being used, part of it being used for administration, I'm talking about the person that answers the phone when you phone and say, I need some help. Her salary is at risk because of these funding cuts. You know, so what are we going to do? We're going to have somebody that's offering therapeutic services, standing waiting and answering the phone because we can't afford to pay somebody to look after the administration of a service that's commissioned. It's ridiculous. It's absolutely ridiculous, and it's scandalous, if I'm being honest. So that's to kind of clarify exactly what we're talking about here. But when that person answers the phone, it's extremely difficult to tell somebody we're going to have to wait 6 or 7 or 8 weeks because they're distraught on the other end of the phone. They're in crisis. You don't phone Northlands unless you're in crisis, unless things are falling apart. So at a human level, it's a very, very difficult situation. The new centre that Northlands has a vision for, that we've been looking towards for 15 years now, we thought that we were making some traction on it. So a lot of things are in place. It's an important vision because we believe that the Northwest is an area where the expertise exists to deliver a centre of excellence within the world of addiction. We believe we're the people that, not Northlands, but Northlands, yes, but I mean the Northwest, and all the services that exist throughout this city and throughout this council area. This is the place to invest in a centre of excellence. I have travelled to other counties in this island. I have travelled into England and Scotland and Wales and further to look at services, to look at models. And everywhere I go, you can pick up wee bits and pieces, but there's nowhere that I've been yet that I thought I would swap what we do for what anybody else does. So I'm convinced that the service that Northlands has is the right way. I guess I know it because I am it. You know, I've been through the process, so I am it. I know it that way. But there are other things that need to be attached to it, like detox, like long-term accommodation, like meaningful and funded aftercare. And that's what the Centre of Excellence would incorporate, along with research and partnership within the universities. The plans for that exist. The location has been identified for many years. Planning has been resubmitted in recent years to council. What is missing is the funding for it, the commitment to it in terms of financial funding. We thought we were making some progress around the Peace Plus money that was identified in the latest round purely for addiction. And I can see that the response to the letter from the Minister of Health to the Council here talks about €8 million being allocated to a community detox facility by COT and partnerships throughout the kind of border corridor. That fund of €17 million initially, in terms of the information that we were given, that initially was for 2 treatment facilities, one in the north of Ireland and one in the Republic of Ireland. And somewhere along the line, that money got lost and has been now, like happens a lot of times, has been reinvested or re-guided down into programme delivery and service delivery. So I think there's a massive opportunity has been missed there. You're talking about an investment, a capital investment of probably around £15 million to build a state-of-the-art facility. And it should be state-of-the-art because people that live with addiction are as entitled to state-of-the-art facilities as those that are living with cancer. Of that, I'm convinced. And I would stand very strong on that. So it should be state-of-the-art. The facility that we're in is not fit for purpose. It's fine, and if you've been there, you'll see that. But it's not what people deserve. And like a lot of addiction services, it's hidden away. It shouldn't be hidden away. We're only adding to the stigma by hiding it away. We need to put the services out front so that people feel that it's okay to ask for help and to come for help. So look, we will continue to look for funding for that. We'll continue to present that. We're well aware of the current landscape in terms of finances within the Department of Health. So we haven't been kind of shouting too loudly about that because we're not silly. We understand the situation that we're in, but still, I think that's what's so frustrating about the the reconfiguration of the money that was set aside in the NDNA, because that wasn't just a financial commitment from the British government, that was a commitment from the British government to the work that Northlands does, and the belief that a centre of excellence within the city, way to go.
Thank you, Tommy. Next indicated speakers, Councillor McDade.
Thank you, Chair, and thank you, Tommy, for coming on. I think most of it's already kind of been covered, but I suppose I just wanted to make a few points. I suppose first, I agree with what everyone has already said. I mean, you won't go down the street anywhere you go, you'll meet someone that'll say the words, Northland saved my life, you know, and that's not an overstatement. That literally lives are being saved every day. So I think it's important to highlight that as well, and just it's not just about the addiction, it's about everything else around it as well. To touch on what Sean said there about the 8 weeks. I mean, 8 weeks, if someone, like you said, that like reaching out is a moment, it's a moment of clarity whenever someone is in that absolute crisis, and to be told that they might be 8 weeks waiting will have devastating consequences in many, many occasions. And I know you said there's a cancellation list, but thinking about that opening of opportunity, if that cancellation comes, chances are that opening isn't there at that time because someone's going to be in the throes of their addiction. So that really worries me. And as someone who's worked in mental health for years and years, we've always talked about mental health being the Cinderella. When you said that, I'd written that down. Mental health is the Cinderella service within the trust. And then addictions and support living were always the two that were the Cinderella service of the Cinderella service, because it's always a second, third, fourth thought. And when we know all the research, all the anecdotal stuff, all tells us that mental health and addictions are intrinsically involved. You know, it's very rare you have one without the other. So we need to be continuing to get that funding. We need to shout about it. We need to continue to do everything that we are doing. I suppose I did have a few questions, but I think they're all pretty much answered. I wanted to say, you know, have you challenged the concerns you have around the Tier 4 review? I know it sounds as if you've been, and I was going to say, is there anything we can do as a council to help you with that? But it sounds like you've it's been kicked down the can by the Health Minister so much, and you're kind of trying to tie him down. So it's good to know. I was going to suggest that we write that letter, so I'm glad that we are. I'm happy to support that. And I suppose, to be totally honest with you, everyone has already talked about it. So I just want to say thank you. I think it's important because it is every family. Every family has been touched by addictions, and whether they went through Northlands or one of the other services, you won't meet someone that hasn't. So I want to say thank you to you and to your staff and to your volunteers and to everyone who has went through the service and has very openly and bravely talked about it. I agree about the stigma. We need it front and centre because, like any other kind of service, cancer is a perfect example. Nobody shames away about talking about it. Nobody gets uncomfortable when you talk about cancer. We need to keep talking about it, and we need to put it out front and centre, like many other things. But I think addictions, it does touch everyone, and there's no doubt about that. So we need to be talking about it. But thank you so much for coming in and for all the good work that you're doing.
Thank you, Councillor McDade. And the next indicated speaker is Alderman Montgomery.
Thank you, Chair, for letting me in. Thank you, Tommy, for coming in. It was great to hear your presentation. I just want to thank you for the fantastic work and the most important work that you're doing. It's amazing to see. It's not just this city, but it's region wide. From the Ulster Unionist Party, like, we do really support and hear what you're saying. We have been in contact with the Health Minister and his office regularly about this issue. We have asked him to come down for a visit. We are quite hopeful that once the Tier 4 regional delivery has been made, that he's keen to get down for a visit to see yourselves. And I'm hopeful that this is going to happen. I know we have mentioned this before in the previous, but I think there was an issue between the Tier 3 and the Tier 4, and he didn't want to compromise anything. From what I'm picking up, I think you've got reservations about applying for the Tier 4, have you? But I would encourage you to just go ahead and apply for it. I know council is issuing a letter, but I'd be happy enough to support for him to come down for a visit. Thank you.
No, we have no reservations about tendering for that process. I guess I'm saying that when we have no awareness of what that process is going to look like yet, or what the criteria around that might be. But we are we're meeting regularly with the Western Trust. We have a really good working relationship with the Western Trust, a healthy relationship there that that will allow us to prepare ahead of that commissioning piece and to get ourselves ready for that in order to be ready to apply for that. I guess we don't have any concerns within ourselves, given that we fully believe in the work that we've done to this date over the last 5 decades. We have no concerns around our capabilities. The concerns arise because of the direction of travel that's indicated within the Tier 4 review, which we have concerns over. And again, as I say, we're not the only ones. The other Tier 4B providers also have some concerns around that. So I guess it would be helpful to meet the minister before that process is set in place to allow him to hear our concerns as a trio of services delivering 4B rather than after the event. So no, look, listen, we will within our own remit, within our own kind of gift, we will be applying because people need it. Is why we'll apply. People need it. People in this city, people in the area, and people from outside the area need residential treatment. And we believe that we are in a position to provide a very high quality service.
Thank you, Alderman Montgomery and Tommy. And the last indicated speaker, if I'm right, is Councillor Boggs.
Gormugget, Ciara, and I don't have anything different to add, but I think that last point that Tommy made there about people need it, and like many others have said across the chamber, we all know somebody who's went through either the Northlands or a similar service, and if, up until I had somebody go through it, you always thought of the addiction and the service as the negative of what you see in that person and the state that they were in before going through the service. But it is about people needing it to get out the other side and the positivity and very cliche, but the new life that people get whenever, you know, the service works and it works for people. We can see it day in, day out from the people that we speak to and from the loved ones that we know ourselves. So I just wanted to also add my own thanks to the positive work that Tommy and his team do. I know a number of people who have went through your service very, very recently, and they say that they are worlds apart from where they were before is the only way that you can describe it. I suppose it's somewhat chilling when we talk about the challenges that are faced by services like Northlands to deliver what they are delivering well at the minute, before you even start to think about how are we going to get the funding to do all those other things that Tommy mentioned here as a region, and particularly in the Northwest, that we need. So there is definitely a fight at the minute in terms of the different tiers that the service goes through and the funding to get them there. But there is a massive piece of work, as I'm sure Tommy knows himself, of where we go after to make sure that the services that we don't currently have or that we should have and there's a desire there to have, that we get those delivered. But I just want to say thanks, and I was glad to see particularly the people of Strabane rowing on behind, because this isn't about the city or the district or it is about the region. And I know the Walk of Hope this year was, you know, the Northlands was a benefactor of that. And I think it just shows again the appreciation that people have right across the north and further afield for the service. So just to add my words of thanks and you know, everybody I think in the chamber is adding their voice of support to do whatever we can at every level to make sure that the Northlands and other services like it are helped going in the future. So thank you very much for coming, Tommy.
So, Tommy, if you've any, so it's just to say thanks very much for coming in. And I know we've all been watching very diligently the whole process of what's been happening with the Northlands. And you've got the full support of this council, and I think it's safe to say that the whole city's behind you, the whole city and district are totally behind you in relation to the Northlands being that centre of excellence and providing that service. Well, I would also like to personally thank you for the work that you do. I see it firsthand through the steering groups that we sit on together in relation to the addiction services. But I also would like to say, I hope you and the staff are looking after yourself as well. It has been a very, very tough time for you all, a very worrying time. All of that escalates and goes home in the families. So I just want to ensure that you are looking after yourself and you know that the support's there if you need it within the community and voluntary sector as well. But thanks very much for coming on today. And I don't think it's going to be the last we'll see of you. We'll be in touch and I'll see you soon. Okay, right, Tommy, thanks a million. Right, folks, we will now move on to chairperson's business. There's a few bits of chairperson's business today, but I suppose I want to bring up, well, it would be remiss of me if I didn't, the performance programme announcement today in relation to the NI Football Fund. I suppose there was sheer disappointment across the city today when we learnt that Derry City Football Club were not successful in progressing to the next stage. But there is congratulations to be given to Derek View, who are progressing to the next stage. I suppose this money is being used by football clubs, particularly Derry City, to redevelop their premises to match the club's ambitions. So I do think it should have been brought to the floor here today to have a brief discussion on it. It's a very serious matter, but I just wanted to mention it in chairperson's business today. So first indicated speaker is Councillor Duffy.
Thank you, Chair, for raising this issue today. I think that everybody across the city was absolutely shocked at the decision. It was a sad day for the Northwest that the Minister has decided to overlook the two clubs that went forward for the Tier 3 funding. And there is anger out there in the community as well, and that has to be said too. And I don't know if anybody listened to Radio 4 today. Bill Anderson was on with Mark Patterson in relation to Institute's ambitions, and I have to say the man did sound like he was in despair, and that's a terrible place for anybody to be in. But probably in relation to Derry City Football Club and particularly the Ryan McBride Stadium, which we have a huge interest in here as a committee and as a council area, I think that we are really disappointed at that decision. I think that we had huge hopes for the Ryan McBride Brandywell being redeveloped. We know the huge ambitions that Derry City Football Club have themselves, and particularly over recent years, we have seen the club grow. We have seen success in the club. We have seen some heartbreak in the club as well. But certainly, as a city and district, we have all got behind Derry City Football Club. So we are just really disappointed. I know the Minister has indicated a further fund, but at this stage we have absolutely no details of what that fund might be or when indeed it might come. So I just think that as a council, officers need to just redouble our efforts with Derry City Football Club, with our discussions around how we help them achieve their ambitions and work with them. Today is a massive setback. It is a huge setback, and there is anger in the community, but let me say it's a setback, it's not the end, and we will continue to work with the club. I know we have been in contact with Derry City throughout today, just in relation to it, so there is absolutely devastation within the club around the decision and the hope that we had moving forward, that today was going to be a positive news day. So look, Karen, I'm just asking yourself to continue the work that we have ongoing with Derry City Football Club to try and move things forward, and we will wait to see what the Minister decides to announce around a further phase. Don't know if I'll be holding my breath.
It's the wrong button. Hey. Thank you, Councillor Duffy. Next indicated speaker is Councillor Tierney.
Thank you, Chair, for bringing me in. And I say at the outset, I agree with everything that Councillor Duffy has just said. February 2017, over at New Buildings, the then Department for Communities Minister, Paul Given, announced that he was considering opening the second phase of the regional substadia funding. In March 2017, I proposed a motion at this council that council prepare a business case and be ready to go as soon as that fund opened. That's how long this council, Derry City Football Club and its supporters are waiting on this fund to open. And I think it's a bit, there is complete anger out there today by Derry City fans and everyone connected to the club, and it's just and it's right. But I don't think the full decision has sunk in to people right across this district yet. In a week, the leader of the DUP told every news station that would take him that this council should be starved of regional funding. We see this decision where Derry City Football Club and Institute Football Club are refused funding from this fund. We were told in 2017 that Derry City and the Brandywell would get money from this fund. We were told that at that time. And today, the bubble has been burst. Now, I agree with Councillor Duffy. Hopefully, this isn't the end, and hopefully there is somewhere where Derry City and Institute can move forward and try and get funding and trying to develop their clubs. But it needs support, and it needs support from government. And government is supposed to support people. This council has invested in the Brandywell. Derry City Football Club have invested in the Brandywell. They need support, and they're not getting it. And I would question the reason why we're not getting it, given the words of the DUP leader this week. And I think council, in conjunction with Derry City and Institute, should be writing to the minister to find out why we didn't receive funding, where we are on the so-called backup list in terms of clubs who may get funding if money becomes available, and what we need to do to move this forward. Because the people of this city and district have waited far too long, far too long to see this happen, and it has just today been wiped away. And I listened to Bill Anderson on Mark Patterson today. He sounded like a man who didn't know what they were going to do, nowhere where they were going to go. The amount of work that has gone on by this council, both clubs, volunteers and everybody to develop these plans and business cases to get them ready for that to be done today, for the North West once again to be let down by Stormont and by a DUP Minister for Communities is disgraceful and shocking, and this council and the clubs involved need to challenge that very, very strongly. And I would suggest, I would propose, Chair, that we write that letter to the Minister to see where we are and what happened and why we didn't get this, how we didn't progress forward. But I do want to wish a club in this council district the very best, and congratulations to them, to Derryview, for getting through to the next stage. But there's questions to be asked, and I would say that given comments that were made this week, that there'll be many people across this city and district that won't be surprised that Derry City Institute have stopped at this point. Thank you, Chair, and thanks again for raising it.
Thank you, Councillor Tierney. And I think at this stage, there will be a meeting set up by Karen and the team, and it'll be like a debrief for the two clubs to see what has happened. And then the letter will be sent to the Minister, because the meeting will take place first, and then there will be a letter. There obviously will be a feedback protocol in relation to DFC coming back to the funders, but the debrief meeting will take place first. We think that's really, really important, that the two clubs are involved from day one. And it is good that we are all behind it and proposing these sort of things, but the clubs need to be involved from the very first. Thank you. So the next indicated speaker is Councillor Harkin.
Thank you, Chair, and thank you for making sure that this was on the agenda today. And I think it is a disappointing day for Derry City and a disappointing day for Institute. I know that both clubs have very, very ambitious plans, and that they were very hopeful, given all the work that they've done over the last couple of years and the obstacles that they got around to get access to the funding stream. And it is a shocking decision by the Minister. And I think that the council, working with the clubs, needs to be on the front foot, challenging this decision. At some point, we should have somebody here that we can actually ask direct questions of, because they should feel the pressure from the council, because the fans expect a an upgrade in they expect an Institute Stadium, and they want to see the Brandywell, the Ryan McBride Brandywell Stadium properly upgraded. And this is a setback today. And I agree. I think that this is sinister, to be quite honest, because this minister has spent this week trying to whip up division in this city and in this district, trying to bring the British Army here, knowing that it would cause division, knowing that it would cause a row, and then to be able to come in on the back of that saying this area shouldn't be getting properly funded by government, and now we have this major decision. So I think it bodes very badly for how Stormont's functioning right now, and it's a non-acceptable way to treat the football teams, but also to treat the district. So if this is the reaction that the minister wanted, he shouldn't be a minister, because he can't treat football teams and council areas like this. So yeah, very, very disappointing, and I think we should do all we can to work with the clubs to try and salvage this and to progress the ambitious plans that they have.
Thank you, Councillor Harkin. Anybody else want to speak on that? So we'll move on to the next item on chairperson's business, and it's me again. I'll just get myself out of the road. And I just wanted to chat about the upcoming recovery walk on the 27th of September from Ebrington Square. So it's a collaborative event, and I suppose it celebrates hope and it celebrates community cohesion with all the partners that are involved within that walk. Within the organising of the walk, with Tommy here today talking about how much addiction services need to be at the forefront of any agenda that we do have. So it was to encourage members to attend the walk on the 27th of September at 11 o'clock in Ebrington. And I suppose I wanted to ask as well if the council comms team could possibly promote that as well on their social media. The walk is about Are You With Us? And I think it's really important, given the state that the Northland Centre find themselves in at the minute. We need to let every addiction service, small or major within this city, know that we are with them. So thank you very much. So the next item on the agenda is, the next speaker is Councillor Duffy.
Thank you, Chair, and I probably should have come in under deputations, but I'll just chance my arm here, Karen. I know that we do have a significant list of deputations coming up, but I just wanted to specifically mention the work of Northwest BAPS. They were established around 3 years ago over the summer period to increase awareness and visibility and support for breastfeeding throughout this council area that has the lowest levels of breastfeeding in the world. So for over 30 years. So I think it's really important, the work that they do. They have really established themselves as a very well respected group, working with both council statutory services and community and voluntary services as well. They have daily events throughout the council area for breastfeeding mummies and families. So the work that they have been doing is great. They actually won an award for the mural round at the corner of the Pram Centre. We as a council provide them with support, but it's not really formalised at this stage. We do a quarterly meeting with them, and it's nearly an update of some of the work that they're doing with statutory services. But I think that maybe as a council we could have more of a formalised role in that, and as such I would like to invite them in to a deputation. I know that we have that significant list, but if there are going to be special meetings called for deputations, maybe we could add them to the list. I would like to congratulate them as well. Over the summer they held a really successful event in Boyle Arena for Breastfeeding Awareness Week, which was really well attended by all services and lots of mummies and babies, and it was a really lovely event, and they are doing fantastic work. So I think it would be really good if we could get them in, people could hear the work that they're doing, and we could probably promote that as well as a council so that people are aware. And if we can do something to increase the levels of breastfeeding support across the council area, I think that's only a good thing. So if I could propose that, Karen, thank you.
Yeah, that's great, Councillor Duffy. I think that's a great idea, particularly when we talk about all the healthy city stuff that we are aiming and endeavouring to do throughout this, through this committee. So that has been taken on board. Thank you very much. And the next person to contact me was Councillor McDade.
Thank you, Chair. I just wanted to come in to express our concern and outrage at the ongoing racist attacks that's happening right across the country at the minute. As we know, here in Derry, we have a proud history of opening our city and welcoming people from all across the world, and have stood down anyone that's tried to arrange any form of anti-immigration protests or demonstrations. And we need to continue to be that loud voice calling out the blatant racism that's evident and becoming more and more dangerous. Our local United Against Racism group have organised a family fun day and cricket tournament here in Derry on the 20th of September out in Ardmore Cricket Club. And whether you've played cricket before or if, like me, you've never touched a cricket bat, I would encourage everyone to come along and give it a go. I recently asked someone that plays cricket what they love about it. And they said it binds the community together and brings so many diverse people together from all backgrounds, cultures and ages. And that within their club, there is a real shared identity and love for the club. And that summarised exactly what the purpose of the event does. I'm asking members here to come along or to share the information with your friends, families, neighbours and colleagues. It's going to be an opportunity for anyone that's new to our city or that has struggled to build relationships here to meet new people and have a bit of crack and some food. And it'll be a family fun day too, so there'll be face painting and bouncy castles for kids as well. I also just wanted to publicly thank Ardmore Cricket Club for very generously letting us use their facilities to host the event. And I'd like to acknowledge the incredible impact that Northwest Cricket has had in bringing communities together, especially considering the horrible decision that was taken during the summer by the Cricket Club in Comber to cancel their summer camp just because East Belfast GAA kids were going to go. I think it's important to recognise that here locally, we've always pulled together to make this place welcoming and open to everyone. So I just really wanted to commend Northwest Cricket Union for supporting us in this and taking a leading role in going forward with it. And just again, like you, Aisling, can I ask maybe that the council share the promotion of the event on our social media and just to advise anyone to get in touch if they want any more information or if they want to come along on the day to experience it. Thank you very much.
Thank you, Councillor McDade. You want to speak on this, Councillor Harkin? Yeah, go ahead.
Thank you, Chair, and thank you to Councillor McDade for talking about what is going to be a brilliant day, which I think is what the vast majority of people support. There is a minority of people who I think have been using social media in particular to spread lies, to spread racism, and but the response to this event shows I think that people want to live in a diverse society and they want to have a positive. Make that a positive thing, and they want to challenge a lot of the lies. But we are at a very frightening moment, and I think that the fact that the Western Trust now has to come out and defend its migrant workers, I think speaks to the fear that exists now within our workforce. I also seen that there was a demonstration, a Locals First demonstration held in Newry over the weekend, and what happened there was alarming, and I want to raise this because I think it needs to be talked about and identified. There was an organisation speaking there that exists in Donegal who promote a white Christian Ireland, whites only Christian Ireland, and they organise, so they support vigilantism. And they've been to many of the rallies in Dublin and parts of the south, harassing migrants. And 2 DUP councillors spoke on the same platform. Now, we regularly come in here and we hear talk from the DUP about, these attacks are not acceptable, but you can't speak on the same platform with people who are openly saying, if you're not white, you're not welcome in Ireland, north and south. And this is actually emboldening when they get support, when the fascists and the racists who are on the streets attacking people outside of takeaways in their cars, when they get political parties going on platforms telling them you've got legitimate concerns, you've a right to be concerned about the number of people moving to Ireland, when they are lying systematically about who's responsible for the pressure on housing, or the pressure on public services, that emboldens them. That makes them feel that they can get away with attacking migrants on our streets. And that's what's happening right now. And there is a huge level of hypocrisy here. You know, you've got the PSNI standing watching this, but then they are now arresting and threatening to arrest people who are wearing a Palestine Action t-shirt. It makes absolutely no sense. So I do think that the grassroots work that's being done by organisations like United Against Racism, but many, many, many others and trade unions, is actually going to be critical to bringing people together and resisting this push from fascist groups, vigilante groups, with the support of some paramilitaries and some in political office. Because I do think we're at a very dangerous moment, and that's what makes bringing people together in a positive way so important. So thanks, Councillor McDaid, for raising this. And look, this is not really, I don't really want to be coming into the council talking about this, but it is actually, it's not got better, it's actually got worse. So it's more urgent that we're on the front foot pushing back against it. Thank you, Chair.
Thank you. And the next,
Chair. Apologies.
oh, sorry,
On the same
Councillor
item, if
Boggs, I
that's
didn't
okay.
see your hand.
You're
Is
okay.
this on the same item?
On the same item.
Yeah, go
And
ahead,
I
Councillor.
want to thank Councillor McDaid for raising it. And this is now the second Health and Communities Committee meeting in a row that we're talking about the same theme of an issue. And I think we should keep talking about it until people hear the message loud and clear. Racism in all its forms, hate in all its forms towards anybody is absolutely wrong. It has to be stamped out. And we have to play our part in that as well as community leaders in our own towns and villages and communities. But that word in this whole conversation, these people that say it's not racism, but, or I don't mind them living there, but, or I work with them, but, and particularly in the case recently of the South West Hospital having to come out and condemn attacks against their own staff, the word but needs to leave the stage as much as the racism needs to leave the stage, because once the word but is mentioned, what you're doing with yourself is aligning yourself against the people who are taken to the streets with flags, trying to chant their own nationalism to stamp on somebody else's life and livelihood, and it needs to end. We had an occurrence, and I'm glad to say that since we haven't had a repeat occurrence in Strabane of racist graffiti being spray painted on someone's house, those are people. And the sooner that other people realise that those that walk amongst them every day, that work with them, that work in the public services that they rely on every day, the people who are serving them behind the counter in the shop whenever they're going to get their loaf of bread and their pint of milk, as soon as those people realise that everybody else is a person as well and that they deserve the same level of respect, I think we might start to see the tide turning. But I do agree with Councillor Harkin. And it doesn't happen often, but I do agree with Councillor Harkin on this. Those who stand in political chambers and try to tell the rest of us about the communities that they represent, who are scared of the person who has come here to make a life for themselves, those people need to stand up and take responsibility for the outpouring reaction that comes from some sections of society that is fueled by the very words that they use in those chambers. I am glad that as a council here, we stand united, or I at least hope we stand united against racism and fascism in all its forms. The same can't be said for chambers not too far from this place. And particularly on Mondays and Tuesdays, when members rise in those chambers to give out about the madness that they say that terrifies their constituents day and daily. It's absolute nonsense. And those in political unionism in particular need to show leadership on this front, need to call out the racism, call out the sectarianism, and get on the same page as the rest of us that it will not be tolerated, and that our actions and our words, while we sometimes, I think, don't believe it, need to start believing that the actions and the words of political leaders actually do matter, and they do fuel tensions, and those tensions need to be dialed down massively. And we need to continue to send our solidarity to those, particularly in our public services, as I have said, to those that continue to face the racism and sectarianism that we have seen over summer months and more recently, and it needs to stop going forward. So thanks again to Councillor McDaid for raising it, and thanks for letting me in, Chair.
Thanks very much, Councillor Boggs. The next, and to get the final piece of chairperson's business, is Councillor Devine.
Very good, Chair. I just wanted to come in to congratulate Developing Healthy Communities and Ulster University on the conference that they delivered earlier this week, Healthier Systems, Healthier Weight. Although I work in the health environment, I found it really informative, but also very shocking. I think we now recognise that obesity isn't just a health service issue, that it's everyone's issue, and we need a joined up whole system response to address this major health crisis. I want to commend the work that the Council is currently doing in this regard, and also I know that they'd supported the conference. I think there's great potential within our community planning model to take the whole system approach forward, because we have a lot of those stakeholders already around the table. I think the cost of obesity is huge, both for the individual in terms of their health and their quality of life, but there's also an immense financial pressure that it puts on our health service and also the impact on our waiting lists. We know that obesity is much higher in deprived communities, and I think resources need to be targeted accordingly. I was really shocked to hear that our council area ranked first in the deprivation statistics across the north and Britain. And I know we like to be first, but not with this regard. 45% of our district was within the top 10% of the most deprived across that whole area. I think we need to shift from a blame culture on the individual to creating healthier environments with a focus on preventative measures. The availability, the affordability and the marketing of healthier options is really important. And again, I think our council need to lead by example with that regard in terms of our facilities and our leisure facilities. And I know that's something that I'd raised previously. And I talked to Karen about it, and I know there's work ongoing in that area, as well as the opportunities to be more active. So our leisure services, our green infrastructure, our built environment, and I know council are doing a lot around and with regard to that as well. So I just want to commend all those that are involved in the conference. I think it was really, really good.
Thank you, Councillor Devine. And as you know, I was at the same conference, and I really everything that Councillor Devine says in relation to council supporting any campaign around obesity. But I suppose what was highlighted as well at the conference was the poverty issue that we are experiencing here in this city and district. And I felt that that seemed to be the common denominator in relation to anything health inequality wise. So I was proud to know that we are doing something about that. We are working towards a local anti-poverty strategy, working towards amending the one that has come out from the minister, and also that council are taking part in all the initiatives in relation to physical activity and nutrition. So just wanted to say that as well. Thank you, Councillor Devine, for bringing that up. Councillor McDade, is it on the same issue?
Yeah. Thank you. Just off the back of what you were saying around the high levels of poverty that we obviously experience in our city and district here, just to highlight, there is actually a speak out protest at 6:45 outside the library there this evening, just in kind of in rejection of the anti-poverty strategy and the consultation. So just to highlight it if we're finished, which hopefully we'll be, if people want to go over that. Thank you.
Then the consultation's actually at 7 o'clock in the library. Okay, everybody, that was the end of Chairperson's business. So we're going to move on to matters arising from the open minutes of H&C Committee on Thursday, the 10th of July. Councillor Boggs.
Two separate matters raising, if that's okay, Chair. HC 171/25, first of all, is the £1 summer scheme. I just want to put on record thanks to officers for the work that they did in relation to the proposal that I had brought about opening more of our outdoor facilities as well as our indoor ones, and to Ryan as well for the communication on it. I think it shows that when a need or an ask arises, we can be reactive and we can try to quickly find something that at least plugs a gap that has been identified by members of the public, and I think that's important. And I think, or hopefully we can build on it going forward, whether it was a success or not, and maybe we can get a further conversation in relation to that. So thank you very much. The second item, Chair, is HC 173/25, and it's to do with Lakeland areas in Ardygirvan. I met today with IPRI in relation to it, just because some of the meetings that have been held, there was a fear, I suppose, from residents that the process of enforcement and tracking and works being completed by the creamery and then further enforcement and all the rest, the process has been taking too long. And to be fair, I would agree with them in some regards. But I am glad to hear from IPRI officials that the Minister is now taking a greater interest in the issue, having been called upon a number of times to do so. But nevertheless, he has got to a position now where he has taken notice. And I am glad to hear that there seems to be a glimmer of hope in terms of progress being made, follow-on works that were completed to the plant at the end of August. So we need to see those works continue. We need to see the progress continue. The residents of Ardagirvan have waited far too long for a solution. Their livelihood has been severely impacted, and we have talked about that before in this committee. But I know that as a council, we will play our part in terms of working with the residents and with IPRI, and would ask officers to continue with that engagement. But I just want to raise it more so to keep it on the agenda of this committee meeting until we do finally see a solution that is that appeases residents first and foremost, but also that allows IPRI then to leave the plant eventually. So hopefully that is something that we're getting to a position of, and I just want to thank officers for their continued engagement on it as well. Thanks, Chair.
Thank you, Councillor Boggs. Anybody else for matters arising? Right, we'll move on to the agenda items. So the first item on the agenda is agenda item 8, social supermarket funding, and that will be Teresa.
Thank you, Chair. So the purpose of this report, members, is to update members on the funding allocation to the social supermarket programme for the 2025-26 financial year and to seek members' approval of the funding allocation to Strabane Community Project and the Foyle Network Foundation. Also to update members, Council received a letter of offer from the Department for Communities under the Community Support Programme, which included an allocation of £399,456.50 to the social supermarket programme. There has been an increase of £23,216.26 from the 2024-25 financial year. The funding to the social supermarket programme is 100% funded by the Department for Communities. The increase is to reflect the increase in costs associated with employers' national insurance contribution and rising energy costs. Strabane Community Project and the Foyle Network Foundation continue to work in partnership with all our key stakeholders across the council area, including the funded advice providers, to provide a wraparound support service. It is recommended that members approve the funding allocations to the Foyle Network Foundation and Strabane Community Project as outlined at 5.1 in the report.
Thank you very much, Teresa. Councillor Clark.
Yeah, I propose that. So look, I just want to welcome the funding for both these projects, both Foyle Community Network and Strabane Community Project. Both have proven to be a lifeline to many of our constituents. But it's a sad state of affairs in this day and age that the families have to rely on food banks and social supermarkets. But at the end of the day, it's as a direct result from a malfunctioning British government that keeps passing on these marks of austerity onto families. However, I welcome the funding. It's vital funding, and it's been put to good use to relieve hardship across our city and district. So I welcome the funding. So thank you.
Councillor Harkin.
Yeah, thanks, Chair, for letting me in. And look, any funding that goes to helping people who are facing deprivation, we should welcome and acknowledge at the same time that there's not enough of it. And because the issues connected to deprivation are actually getting worse. And this is why it's so frustrating that the executive, as we say as a council in our consultation response to the anti-poverty strategy, that the actual document that the executive has signed off on is a missed opportunity. And because the reason why this funding's going out, the reason why we have these social supermarkets is because of 2 decades of austerity that has actually driven up the levels of poverty and deprivation in our communities. And simply trying to throw a bit of money at it is not going to solve the problems, as we all know. But that's why there was a lot of expectation built up around the anti-poverty strategy, and that's why it's so frustrating. So very happy to support this funding going out. Hope it gets to people and helps people, but that you know, it is not going to be able to address the scale of and challenges that people face in our communities.
Thank you. Councillor Harkin. So we'll move on to the next item on the agenda, number 9, additional good relations funding, and that's Teresa again.
Thank you, Chair. The purpose of this report is to update members on additional funding of 20,000 to the District Council's Good Relations Programme to address racial tensions and improve social cohesion, and to seek members' approval of the issue of letters of offer to the lead groups. The additional funding was aimed at areas that had experienced racial and social unrest. A number of areas in the city were identified as having experienced social unrest in June of this year, and the additional funding was allocated to provide support for local action within communities to prevent further unrest. Officers have engaged with the neighbourhood renewal strategy managers and the local growth partnerships for the Ballyairnett, Moore and Waterside DEAs to co-design the action plans. A meeting of the Good Relations Working Group took place in July to update members on the additional funding and the proposed co-design approach. The action plans have been reviewed by officers in line with the objectives of the fund, and it is recommended that members approve the funding allocations to each of the 3 lead groups as outlined at 5.1 in the report. In addition, just to advise members, the Executive Office have been in contact with 11 councils this week to notify them that there will be potentially an additional funding offer of 27,000 towards tackling racial and social unrest. A meeting will be set up with the Good Relations Working Group and key stakeholders, and a further report will be brought to committee to update members. Thank you.
Thank you, Teresa. First indicated speakers, Councillor Duffy.
Thank you, Chair, and I'll be brief on this. I'm more than happy to propose it. Additional money coming into any of our areas is always welcome, and particularly with additional money on top of that now, Teresa. We had a meeting of our growth partnership this morning and this was discussed, so the money will be put to good use in the community, so thank you.
Thank you, Sandra. Councillor McDade.
Thank you, Chair, and thank you for the paper. And I'm happy to second the paper. And I mean, we've just had a big discussion around racism, so we know the importance of investing and put the money to good use locally. So delighted to see it, and hopefully there's more to come. Thank you.
Thank you. We will move on to agenda item 10, neighbourhood renewal, active citizenship through sport funding, and that's Teresa again.
Thank you, Chair. The purpose of this report is to update members on the Neighbourhood Renewal Active Citizenship through Sport programme and the funding allocation for the 2025-26 financial year, and seek members' approval of the issue of letters of offer to the league groups within the 5 urban DAs, including the approval of £10,000 towards training to be delivered by our Council's Sports Development section. The Neighbourhood Renewal Active Citizenship programme has been running since 2006 and is 100% funded by the Department for Communities. The aims of the programme is to enhance the levels of physical activity programmes in each of the 5 neighbourhood renewal areas through promoting volunteering and active citizenship. A grant funding agreement has been received from the Department for Communities, which has confirmed a total budget of $56,753.26 for the 25-26 financial year. The budget is broken down into programme costs of $39,587.82 and £10,000 to deliver accredited sport-specific and generic coaching courses. $7,165.44 has been allocated to a flexible funding element. Officers have engaged with each of the Neighbourhood Renewal Partnership Boards, utilising the co-design approach to the development of the action plans based on the needs of each of the areas. The action plans have been approved by the Department for Communities in line with the objectives of the funding. It is recommended that members approve the allocations to each of the 5 neighbourhood renewal areas and approve the issue of letters of offer to the league groups outlined in 5.1 in the report. It is also recommended that members approve the allocation of £10,000 towards the sport-specific and generic coaching courses, which will be managed internally by Council Sports Development section. Thank you.
Thank you very much, Teresa. And I just need to declare an interest at this point that where I work as a beneficiary of the fund. But Councillor Clark, you were looking to come in on this item?
Good Chair. Yeah, I want to welcome the active citizenship funding. It's a much relied on pot of funding within the community sector. And I've had the benefit of seeing it at first hand in the Ballyarnett DAA. The funding is used to develop and deliver various exercise programs, which are used to tackle sedentary lifestyles, obesity, and to try and manage the onset of type 2 diabetes and various diseases related to high blood pressure, etc. And as we know, these are all issues that are clogging up waiting lists and hospital appointments across the NHS. So this funding is it's very impactful. It does make a difference, and I think it's great. And I really welcome the funding. It's really much appreciated. So thank you.
Thank you, Councillor Clark. Councillor Devine?
Good Chair. I totally agree. I think it's a great opportunity for those groups that have received funding. And I also appreciate it coming from the Department of Communities, but unfortunately our rural communities have been left out, and I think they also need to be involved in sports participation. And we know that particularly the area that I represent myself is in the top 15% in terms of deprivation, and we've just talked about those statistics in terms of obesity. So I suppose that I'm a little bit disappointed in that regard, and we are awaiting now the publication of the rural audit and the results of that in terms of highlighting sort of disparities in funding. So we're looking forward to that coming out, that we can use that maybe in future for those types of things. So, Gormaig.
Thank you, Councillor Devine. Councillor McDade?
Thank you, Chair. And I don't know whether, if Caroline didn't second it, I'm happy to second it, but I think it's great. I welcome the funding, and anything through sport, I think it's just so important. Sport brings people together. It encourages that kind of active activity. It encourages activity. It's so good for your health, your mind, everything. So I think anything at all that we're doing and we can promote and fund is just super important. But again, I would agree with the rural element. Again, it does seem to happen a lot, and Councillor Devine is correct, but Ballyarnett's in there, so selfishly I am happy. Thank you.
Thank you, Councillor McDade. We will move on now to agenda item 11, Strategic Sport Partnership Investment Programme, and that will be Ryan.
Thank you, Chair. The purpose of the report is to update members and seek approval to deliver the pilot Strategic Sport Partnership Investment Programme. Members will be aware of previous motion for officers to explore the opportunity to implement a sports development programme open to governing bodies to assist the development of local sports systems. Officers previously updated members with a proposal to deliver the programme, which would be a 2-year pilot, and that a further update would be presented for consideration, including the final draft of an application process before the launch of any programme. The programme would be open to organisations with responsibility for the strategic planning of sport in the district. To be eligible, each sport must have governance structures that are recognised by both Sport NI and Sport Ireland. If approved, an open competitive application process for all eligible organisations would be planned to be open in October. As part of the application process, the form has been included for members' information. The applications will be assessed on the following criteria: baseline, action plan, strategic fit, project management and budget. The pilot for the 2-year would commence in January 2026, with assessments taking part in November and hopefully successful applicants notified in December. A steering group for each sport would be established between key stakeholders, including council, governing bodies and local clubs. The steering group would be responsible for providing strategic oversight and successful implementation of the plan. Each successful organisation would be required to provide match funding of up to 50% to a maximum amount of £10,000. There is a recurring budget of £25,000 in place that was part of the 25-26 rates process. So the recommendation is that members note the contents of the report and approve the delivery of the pilot Strategic Sport Partnership Investment Programme. Thanks.
Thanks very much, Ryan. Anybody want to speak? Councillor McDade?
Thank you, Chair, and thanks, Ryan. And I'm happy to propose the paper. Again, like the previous paper, anything we can do to the investment sport's brilliant. The only sort of concern would be by the time this goes to full council and be ratified, we're going to be like the first week of October. And is the closing date going to be in October for the assessments in November and to be out in December? So it's a quick turnaround for anyone that's going to apply for it. That'd be my only concern, but happy to propose and thank you very much. Thank you, Councillor McDade. We will move on to agenda item 12, End Violence Against Women and Girls Change Fund, and that will be Teresa.
Thank you, Chair. The purpose of this report is to update members on the potential funding from the Executive Office to support continued delivery of initiatives aimed at ending violence against women and girls, and for members to consider and endorse the approval of funding to the groups on the reserve list who previously applied to Tier 3 Open Call Change Fund. The approval will be subject to Council receiving formal confirmation from the Executive Office and an appropriate budget being allocated. Members will see a list of the groups who are on the reserve list at Appendix A in the report. The Executive Office notified Council in July of the potential for additional funding to support end violence against women and girls during the 25-26 financial year, which is subject to ministerial and business case approvals. Council is currently awaiting a formal letter of offer from the Executive Office. In the interim, all councils have been asked to give consideration to utilising additional funding to address the unmet need from the previous open call process, as well as to support council-led actions and the delivery of programmes through the consensual model with the 8 local community growth partnership boards. Members will also be aware of the allocation that was provided to each of the 8 local community growth partnership boards for the delivery of programmes and activities aligned to the prevention outcomes within the End Violence Against Women and Girls strategic framework. If additional funding becomes available from the Executive Office, officers will engage in a co-design process with the 8 local community growth partnership boards to build on the work carried out to date. It is recommended that members endorse the approach detailed in the report and approve the allocation of funding to the groups on the Change Fund reserve list, including an allocation to the 8 local community growth partnership boards, subject to available budget and receiving a formal funding confirmation from the Executive Office. Thank you.
Thank you, Teresa. Councillor Devine.
Happy to propose that. I welcome this additional funding. Every penny invested in challenging harmful attitudes, raising awareness and keeping women safe is welcome and very much needed. We must also make sure that initiatives reach out into our rural communities. Awareness, support, transport and safe places have to be accessible right throughout our district. Since we last met, unfortunately, there has been another tragedy in Maguire's Bridge. Vanessa White and her 2 children, James and Sarah, were murdered in their own home. And I'm sure everyone here and within Council would join me in offering our heartfelt condolences to their loved ones, and our thoughts and prayers are with them and with the communities of Maguire's Bridge and Bearfield, County Clare. We cannot accept news like this as inevitable. We must do everything in our power to end this scourge in our society. With this funding, we must deliver real change so women and girls feel safe and are safe within our community.
Thank you very much, Caroline, for speaking about the Maguire's Bridge incident, and solidarity comes from this chamber to the families involved. It was a terrible, terrible incident. I suppose I just wanted to say that, you know, the promise from the Executive Office to tackle ending violence against women and girls, I think that they are working very, very hard to do this through funding, but also through initiatives that are filtering through the community and voluntary sector. I will be attending Belfast on Monday at the Ulster University campus to take part in training that has been designed by Queen's University in relation to coercive control, and it's called Head, Shoulders, Knees and Toes. And this training will enable community leaders to bring resources back to their community, train younger people in relation to what coercive control is. So I do think that, you know, through funding, actions are speaking louder than words, and I think the Executive Office are doing everything in their power in relation to the ending violence against women and girls, and we will do everything in our power here as well in order to get money and resources throughout our communities as well. So thank you, Councillor Devine. Councillor Harkin.
Thank you, Chair, for letting me in on this. And look, this is a very, very important issue. And I think that it's proper and right that the Executive Office is paying attention to this. And I think that the Executive Office is paying attention to this because of there was mass rallies in cities across the north. There has been, the women's sector has come to councils with like proposals for strategies to address violence against women and girls and the push towards an end to gender-based violence. I'm not convinced yet that the executive will actually see this through. And my concern is related to a previous discussion we had here, because if you look at the vigilante groups, for example, in East Belfast, the reason why they say they're walking in the streets is to protect women and girls. And I think that, again, they are using this excuse to justify attacks on migrant homes. We see also families being put out in North Belfast. So there's a huge level of hypocrisy here in terms of the people claiming to defend women and children who are actually terrifying women and children and making people feel unsafe in their streets. And I just feel like, again, that this seems to be getting tolerated, and that political parties, rather than challenging the lies that these people are putting out, I'm talking about the vigilante groups and those who are blaming migrants for violence against women and girls, and are instead leaning into it and emboldening people by saying that they have legitimate concerns. So I think that we are going to see an end to gender-based violence through grassroots efforts, and I think that's going to come through community groups, sporting groups, trade unions, everything that makes up civil society pushing against it. But I do think that there is a dangerous grouping who are a minority right now, who are clearly have used the excuse about protecting women to attack other people, and they attack migrants in particular, and they're actually terrifying a lot of women and children right now in our society.
Councillor McDade.
Thank you, Chair. And I just wanted to welcome the funding, and to also offer our support and condolences and solidarity to Vanessa White's family and friends. I agree with what Councillor Harkin has said too, the vigilantes, and there was a talk of it here locally as well about protecting women and children. These people are not out to protect women and children. They don't have that at heart. Violence against women and girls is not a new thing. This has been around the whole time there's been humans around. So I think that it's good to have a focus on it, and we have to keep the focus on it at every level. So grassroots, council, Stormont, Westminster, the Dáil, everywhere. We need to keep the focus on it, because the only way of ending it is to continue to speak about it, remove any stigma, take away that kind of hidden fear around it, and continue to fund anything we can to educate our young people right from primary school age right up, so that in the future this will not be a problem, in the very near future, hopefully. But definitely for generations to come, we need to create a safer space for women and girls than what we have right now. But it's not a new problem, but I'm glad to see we're doing something about it. Thank you.
Thank you, Councillor McDade. We'll move on to agenda item 13, and it's the consultation response to the Department of Health and Social Care, Children and Young People's Emotional Health and Wellbeing Framework, and that is Teresa.
Thank you, Chair. The purpose of this report is to seek members' approval on the draft response to the Department of Health consultation on the Health and Social Care, Children and Young People's Emotional Health and Wellbeing Framework. The framework has been developed to align with and complement the vision and aims of the Department of Education's Children and Young People's Emotional Health and Wellbeing Framework. The framework sets out a consistent system-wide approach to children's emotional health and wellbeing provision over the next 10 years. The framework will drive the work and ultimately help support service improvement and partnership working across health, education and other key services and agencies, including working collaboratively with the community and voluntary sector. Centred around the needs of children and young people, the framework is primarily aimed at ensuring the best possible outcomes for children through the continuous improvement and enhancement of existing services and support for emotional health and wellbeing. Members will see at 2.6 in the report the key issues in which the Emotional Health and Wellbeing Framework aims to address. Members would also see at 2.7 in the report the values in which the framework is guided by. A draft response has been prepared to the consultation as included in Appendix A of the report. Members are asked to consider any comments or additions for inclusion in the consultation response and to bring to members' attention that the consultation period closes at 5 p.m. on the 26th of September 2025. It is recommended that members consider and approve Council's consultation response to the Health and Social Care, Children and Young People's Emotional Health and Wellbeing Framework. Thank you.
Thank you, Teresa. I just have a question, if that's all right. Was there consultation with any other organisations in relation to Council's response, or was it just a direct response from Council?
Chair, there's been engagement through the Children and Young People's Working Group and our Children and Young People's Officer, but not as wide as the external.
Right. No, that's grand.
I
Thank you,
suppose,
Teresa.
Chair, just the response, I suppose, is coming from Council's perspective on.
Thank you. Anybody else want to come on this one?
Chair, I'm happy to propose it. I think it is really important. It's a good piece of work. And it's really important that it is child-centred and takes that collaborative approach to children's health and wellbeing. So just to propose the consultation response from Council. And I take on board your point, Chair, but I think this consultation has gone out wider, so there will be responses from other people as well and other agencies. So.
Councillor O'Farrell?
Groma Cahill, happy to second it.
Right, we'll move on to agenda item 14. So the Department for Agriculture, Environment and Rural Affairs consultation on the proposed new rules for the sale and supply of puppies and kittens in NI.
Thanks, Chair. Members, the Department launched this consultation in June and it closes next week. The proposed new rules relate to animal welfare protection, which includes introducing a registration scheme for the sale of pups and kittens under 6 months old and prohibiting third-party sales, which is similar to Lucy's Law in England, Wales and Scotland. A draft response to the consultation is included for members to consider, and the key points are outlined in section 3.5 of the report. And Chair, it's recommended that members approve the draft consultation response.
Councillor McDade?
Thank you, Chair, and thanks, Seamus, for the report. And I'm happy to propose it. Very briefly, I mean, hopefully this will outlaw more strictly puppy farms and the equivalent in the cat world, because there's too much animal abuse, and whenever it comes to puppies and farming them out and breeding them for money, and that this seems to put a bit of regulation around it. So I'm happy with our response and happy to propose. Thank you.
Councillor Boggs?
Concur with Councillor McGade and I'm happy to second, Chair.
Thank you. Agenda item 15, the consultation. It's an assessment and rating of the wind turbine noise guidance, and that's Seamus again.
Thanks, Chair. Members, the Department of Energy, Security and Net Zero is seeking views on an update to guidance currently used by councils in assessing planning applications for wind developments. Members, you'll be aware that the Environmental Health Service would review acoustic consultant reports for a range of single wind turbine and wind farm applications. So acoustic experts and scientists were involved in producing the proposed updates to the guidance, which has been in place since 1996. The Environmental Health Services across the 11 councils convened a working group to consider a response to the consultation. And the consultation response has been submitted before the closing date, which is the 29th of August. However, any further comments from members can be submitted. And Chair has recommended members note the contents of the report and approve the draft response.
Councillor Duffy?
Just happy to propose the response from Council. As an urban councillor, it's not something that I deal with regularly, but the response was very informative, Seamus, so thank you for that.
So the next item on the agenda is agenda item 16, the food service plan, and that's Seamus again.
Thanks, Chair. And members, I'll be brief. All councils are required to produce a food service plan outlining the national food law priorities and standards to ensure they're addressed locally. The plan reflects the new food standards delivery model, which was implemented in May with the support of the Food Standards Agency. The plan also highlights the good work completed by the Environmental Health Service in 24-25, and the recommendations members note the content of the report and approve the food service plan.
Councillor Devine.
Happy to propose, Chair.
Thanks, Councillor Devine. Councillor Boggs. Agenda item 17, and it's the street trading policy, and that's you again, Seamus.
Thanks, Chair. Members, the report outlines the legislation and procedures councils must follow in relation to street trading. Members may recall back in 2020, Council approved a policy which was designed to promote consistency and provide clarity to Council's decision-making process, and also ensure Council meets its legal obligations. The policy has been updated to include current criteria for temporary licence applications and conditions regarding the display and sale of items. It's also proposed that Council officers introduce a pilot scheme where event organisers take responsibility for ensuring traders at their events operate safely. And Chair, members are asked to note the contents of the report and approve the revised policy, and also approve the new arrangements for licensing traders at community events and festivals for a trial period.
Councillor Boggs.
Margaret, Chair, and thank you, Seamus. I'm happy to propose the recommendation. Just a couple of things to point out. There has an issue that has been raised with me, and I know with other members of our team as well, in relation to the term enclosed premises, and some businesses maybe determining that as something different to what somebody else may determine it as. So I suppose just when we go back out with this policy now, just if we can put a bit of focus on the communication aspect of what that actually means for those that it affects. But I think particularly, you know, people being able to apply for kind of a group trading license as opposed to everybody at one event having to apply for their own as a common sense approach. And hopefully 3.10 may be an opportunity in the future in relation to the cost. So I think it's well worth a trial and happy to support. Thanks.
Thank you, Councillor Boggs. Agenda item 18, the draft dog control work plan, and that's you again.
Thank you, Chair. Members, the main objective of the Dog Control Service is to promote responsible dog ownership through education and enforcement activities outlined in the plan. In order to protect the public from dogs not under control, including dangerous dog breeds, the Council has introduced dog control orders and continues to enforce dog control legislation. The report outlines the current position in relation to dangerous dog breeds, and it also outlines the statistics which are issued to the Department on a quarterly basis. The team continue to deliver a schools education programme and will be carrying out an initiative with the cleansing team within Council to help reduce the number of dog filing complaints and promote the Green Dog Walker scheme. Chairs recommend members note the work activities undertaken by the Dog Control Service, endorse the work plan and approve the request for additional staff resource to deliver the work plan. Thank you, Chair.
Councillor Farrell.
Okay, Hurley. Thanks very much, Seamus, for the report, and I'm happy to propose it. But I've just a couple of questions for you, a couple of queries anyway, because recently I have people getting on to me about dog fouling outside primary schools and nursery schools, and their complaint to me is there doesn't seem to be any deterrent. You know, there hasn't been that many people fined for their dog fouling, whatever. And the other thing is that they're saying they haven't seen dog wardens on the ground, but I appreciate we don't have that many dog wardens, and they cover a vast area. Now, I did see the thing there about CCTV, mobile CCTV, but at schools and primary schools, I think it's necessary that you do have cameras there permanently to stop it, because in some of the nursery schools, the children and the primary schools, they're carrying the dog dirt or into the schools. Now, youngsters at nursery school, they're not aware of the dangers of the dog poo and mightn't even be aware that it's on their shoes or hands or whatever. And we all know the dangers. Now, I see the fines are £100, and people say that's not even a lot. But what we need to be thinking about is the cost of a child's eyesight. And you know, who wants their child to be blinded at school? Now, a friend of ours lost sight in one eye, and it's to do with that same issue. So I think myself, if we could get the CCTV erected permanently at primary schools, would be a good deterrent. But definitely, we need these, the dog wardens need to be more visual. I know who the one is for our area now, but I haven't seen him. The fellow was there before, had many conversations with him, but he said to me his job was an impossible task because you need people to stand up and say this person is not lifting their dog dirt or whatever. So, but listen, I'm happy to propose. Groma, good Seamus.
Yeah, go ahead.
Chair, thanks. And Councillor Ford, we will look at the option in terms of either cameras and or signage at schools and bring a paper back in relation to what the options are. I'm just mindful, and that's the reason why we've recommended additional resources, that recently the focus has been dealing with dangerous dog breeds, and we have an increase in the number of attacks on people, livestock, pets, and there's a number of legal cases ongoing. So I'm happy enough to take on board your recommendation.
Thank you very much. And we'll move on to agenda item 19, and that is the deputations update, and I'll pass it to Karen.
And members, we have discussed earlier in the meeting deputations, so I will take the report as read. So obviously, Councillor Duffy will add North West BAPS to that list. We also have a request from Voice Matters to come to speak to committee about the report which they are launching on the 13th of November at St Colum's Park. So members will share that invitation with you, so you may wish to opt to go to that. And I think Chair has another suggestion to make.
Yeah, thank you very much, Karen. And it's arising from the conference that myself and Councillor Devine had attended at McGee in relation to healthier systems, healthier weight. And we had a discussion around the role of developing healthy communities within our city and district, and about the accolade of us being a healthy city, the role that they play through the World Health Organization, how they're a partner of the World Health Organization, and some of the commitments that be made at the meetings, the leadership meetings. So we wanted to propose that we get a deputation from developing healthy communities, and the funders, the main funders of that organisation, who are council, the PHA and the trust, in relation to their plans going forward. I had spoken to Adele, and she is going to draw up a document in relation to how they're foreseeing the services going forward. So it's just to put that on the agenda item as something that everybody can be informed about in relation to what the vision is for us being a healthy city going forward. So thank you for that, Karen.
Members, we will try to table the special meeting as easily as we can without putting you under too much pressure with the rest of your schedules. We try to at least move one of those before Christmas. Okay, thank you.
Councillor Devine.
Chair, just to say that I'm happy to propose that. I think I was happy to propose it anyway in terms of the special meeting, but I think now that we have more deputations coming in, that's probably important. And I think it is important as well that we hear from Save Our Acute Services following our discussion, I suppose, from our last meeting as well. And hopefully that's all right, because I know why it's all right for me to propose, because I know I've requested one of those deputations as well. And I think it's important that we hear from all of those. So thank you.
Sounds good. Thanks very much. So we're moving on to open for information, and I will just go through the list. If anybody wishes to speak on any of them, you can raise your hand. So agenda item 20, Derry and Strabane Policing and Community Safety Partnership Annual Report. 21, the Drinking Water Report for NI. Sorry, Councillor Harkin, which item was it? 21? 20, sorry. So we'll go back to 20. Councillor Harkin, sorry about that.
Thank you, Chair, for letting me in. Look, yeah, I'm looking at the dates there, April 1st, 2024 to March 31st, 2025. So this pertains to, and this is for people who are on the policing board, because I think that the PSNI need to be held to account on this, which is the it's the focus around criminalisation of Palestine solidarity. And Chair, as you know, there's been a number of councillors who've been either arrested or are facing PPS charges, and that also applies to citizens, residents of Derry. Our MP for Foyle is facing a possible charge as well, and I would contend, and I think that the PSNI and the policing board has to address this, which is that all of this is peaceful protest, and it's being criminalised, and a lot of people are being harassed. And now, since the prescription of Palestine Action has come in, and a lot of people here in Derry have challenged it, particularly civil rights veterans have stood in the Guildhall every week since the prescription came in, declaring their support for Palestine Action. And the policing has got heavier and heavier and heavier. And a lot of people are being stopped in the street because of their support for Palestine. And it just seems, when I watch the police doing nothing about people carrying, for example, UVF flags in Derry or putting them up, or I watch vigilantes in places like East Belfast actually attacking migrants and the police don't do anything about it, it just seems like there's a serious problem with the way that policing is being conducted. And that's just, that is becoming, it's all the more evident now with people who are protesting genocide being criminalised, when the evidence is very clear that a genocide is being carried out. So I think that this has to be addressed, hopefully at the policing board level, and I think that we need to put questions to the PSNI at every opportunity, and obviously the Justice Minister as well, about why this is happening, because I think it is. I think that the hypocrisy of this it has only become more evident as the scale of violence and barbarism that Israel has conducted has been documented across the world. Thank you, Chair.
Thank you, Councillor Harkin. So we'll move on to open for information. Sorry, I'm just conscious it's past 6. Will we just keep rocking on, or do you want a break? Keep going. So agenda item 22, determination of applications for registration of societies where the lottery prize is insured. License 23, licenses, permits and orders issued under delegated authority. Item 24, correspondence. Councillor Devine.
Guramayagat Chair, it's just in relation to 2.2 and the Department for Communities Move More, Live Better. Very fitting in terms of what we've been discussing today. I went in to have a look at their website, and they are promoting different types of activities. And within Derry City and Strabane District Council's area, we have one group activities displayed there. I think that's disappointing. So I would ask maybe that we could tie in with that and get all of our activities promoted there. Thank you.
Thank you, Councillor Devine. Agenda item 25, consultation list. Councillor Devine.
Sorry, Chair. On the consultation list, there is one for We Matter, Learning Disability Service Model. And I would just like to ask if we could just take a wee look at that to see if it would be appropriate for Council to put a response into that, please.
No problem. Thank you, Caroline. (26). So agenda item 26, it's the child rights, and just for an update for members, there will be a meeting tomorrow with UNICEF by council officers in relation to the outcome of the assessment process. So Karen and the team will be in touch with members as soon as we have any further information in relation to that. So thank you. Right, confidential for decision. Can we go on to confidential? Can we have a proposer and seconder? Councillor McDade and Councillor O'Farrell. I've just soaked myself.